everybody. Welcome back to another week of Bulletproof Hygiene. I'm so excited to have you joining me this week. Today's title is a little crazy because we talk all day long and we're asking people to open their mouths all day long. But this podcast is titled Time to Shut Our Mouth. So hopefully you're intrigued by this, and we're going to have a really great conversation and thought here. Before I dive in too deep, I want to just kind of put a promo out there for our summit upcoming next year, 2025, because we just finished our summit 2024 and it was amazing and you don't want to miss the next one. So I want you to be able to go ahead and put this on your calendars and start talking to your doctor and your team about this, because we've got to have you with us. We always say we do this together as a team so that we can truly be bulletproof. So mark your calendars for next year, August 8th and 9th of 2025. We are going to be in Orlando, Florida at the Ritz. So put it on your calendar and start talking about it, and let's see you there. I can't wait to meet you in person. So I'm actually flying solo today on a topic that I'm really interested in, fascinated by, and often frustrated by, and have seen so much of it lately that I think it's something we all need to have on our radar. And that is the topic of mouth breathing. So I have plugged IDM Scholar Society, it's Integrative Dental Medicine Scholar Society, in previous episodes. And I've done that just because it's an incredible group of practitioners, both on the medical and the dental side, who are really putting their heads and experience together to treat patients collaboratively, which I know that you guys know, I believe that's true whole body healthcare. And I have attended their last two symposiums and learned so much about the importance of airway and how it impacts oral health. They do also have a really cool online study club. So I'm going to attach to our show notes here, but you can check them out. Their website is idmscholarsociety.com. So check them out if you find this topic really interesting and you want more information. So why should we as hygienists care about whether our patients are mouth breathers? There are so many reasons. So I want to dig into this topic on this episode to help us all understand what to look for, what questions to ask, and how to help patients correct it. And before we get too deep in this pool, I want to make a few reading recommendations. I love to read, and there's so much out there on this topic that is so helpful and really takes a good deep dive to understand this. First of all is the book Breath, written by James Nestor, and it is an incredible read for understanding why nasal breathing is so important and how mouth breathing can be so detrimental to our health. It's a wealth of knowledge, so I definitely recommend checking it out. And then second is the book entitled The Shift, The Dramatic Movement Toward Health-Centered Dentistry. It's written by DeWitt Wilkerson, and it is a literal step-by-step guide to implementing complete health through dentistry with a significant focus on airway. All right, so back to mouth breathing. Let's just define that. Mouth breathing occurs when people rely on taking air in through their mouths instead of their nose. It can be a short-term situation or a lifelong, depending on the root cause. Most cases of mouth breathing are caused by obstructive nasal airways, and this can happen because of nasal and sinus congestion, which would be more of that short term, like having a cold or a flu or a sinus infection, or more of long-term issues and obstructed nasal airways with things like a broken or malformed or deviated septum, chronic allergies, asthma or sinus infections, nasal polyps, or enlarged adenoids. Other issues that may drive being a mouth breather are more structural defects, like a tongue tie, which creates low tongue posture, blocking airway, also cleft palate. Anxiety can also be a driver, as it induces more rapid, shallow breathing as the brain and the autonomic nervous system goes into fight or flight response. Most people develop mouth breathing as very young children, potentially setting the stage for long-term problems. And things like improper facial development, allergies, chronic congestion, speech complications, malocclusion, and newer studies are showing a connection to behavioral disorders like ADHD and ADD. Mouth breathing is also linked to sleep disorders like upper airway resistance syndrome and obstructive sleep apnea. So what we breathe through, why does it matter so much? Either way, we get oxygen, right? Well, technically, yes, but we have to look at the purpose of each and how they were designed to understand why it matters. That being said, let's just establish that the nose is for breathing and the mouth was made for eating and speaking. When we breathe through our nose, tiny hairs called cilia filter out debris like allergens, pollution, and even small insects, which is kind of gross, but they're there. Your mouth doesn't offer that protection. Your lungs and throat function better with warm, moist air, and your nose has bony structures called turbinates that handle that task. Air you take in through your mouth is drier and typically cooler, and likewise, your throat and lungs, they thrive on warm air. So when you breathe in through your nose, the air you take in gradually warms up until it's closer to body temperature, making it easy for your tissues to absorb. Nasal breathing also promotes the production of nitric oxide. And you guys know I'm a big fan of this. I've done podcasts on this in the past. But nitric oxide is a molecule that contributes to widening blood vessels and delivering oxygen to cells. Additionally, nasal breathing helps maintain the proper balance of oxygen and carbon dioxide in the body, which is essential for good health. When we breathe through our mouth, we skip this filtration system. Mouth breathing naturally leads, obviously this makes sense, to dry mouth and thus bad breath. And as we know, a reduced salivary flow means we aren't buffering the acidity we come in contact with throughout the day, leaving us in a more acidic environment. Our saliva isn't able to flush away and remove food particles and bacteria, driving bad breath and an excess accumulation of plaque and microbes. I explain to my patients that dry mouth is kind of like Velcro to the plaque. It allows it to adhere quickly and build fast. And since we know that the pathogenic bacteria prefer an acidic environment, it is a match made in dental health, driving both decay and periodontal disease. Mouth breathing can cause the throat and surrounding muscles to weaken over time. This weakening can lead to snoring or sleep apnea, which, as we know, is detrimental to our quality of life and longevity, as if left untreated, could lead to problems including daytime fatigue, high blood pressure, heart problems, and type 2 diabetes, all of this according to the Mayo Clinic. Mouth breathing also drives inflammation, and we know this, we see it in the mouth, right? Not only, though, of the oral tissues, but also the tonsils and the bronchial tissues, which can lead to more frequent respiratory infections and asthma episodes. Mouth breathing has also been linked to lower brain oxygen levels, which can lead to brain fog and diminished memory and cognitive function. So this is a huge deal. So hopefully you're tracking with me that where we breathe from matters in a really big way. There's some crazy side effects that come from just breathing through our mouths. And guys, as hygienists and dental professionals, we have a front row seat to the show and have a huge opportunity to bring awareness to our patients. So let's start with being the detectives we are, discussing what visual signs we can identify to take a proper assessment for airway issues and mouth breathing. And it actually starts in the reception room as we go to greet our patients. Take a look at their facial structure. Mouth breathers commonly have longer, more narrow faces, forward head posture, parted lips, dry chapped lips, poorly defined cheekbones, tired eyes with often dark circles below, retruded, set back jaws, crooked noses, and malaligned teeth. It's hard to give a good visual, obviously, over audio for those of you that are listening. So I want you to think Napoleon Dynamite as a good classic example of a mouth breather. As we review medical history, so we've seen what they're looking like. We've visually made notes of anything that looks like, there may be something going on here. Now it's time to start looking at medical history. So here's where we may see conditions and medications listed to treat allergies, reflux, which we know can be driven by apnea, frequent sinus infections or bronchitis, chronic asthma, high blood pressure, diabetes, and sleep apnea. We may hear frequent throat clearing or hoarseness when they speak, and obviously they may be complaining of dry mouth or bad breath. Now it's time to lean the patient back and look in their mouths. Here we may notice that halo of redness and inflammation specifically around the anterior teeth, as well as heavy plaque or calculus buildup, again, primarily in the anterior region. And you'll note that it's not typically that way in the posterior. And I'm telling you guys, once you kind of see this and learn it and know it, you can't unsee it. And my doctor had come to me, he had a consult in his chair a couple weeks ago, and he came and he said, "Hey, will you quickly just look at these photos and x-rays with me and tell me what you think?" And I opened the first photo and immediately said, "This is a mouth breather," because you could see we had a retracted bite photo that just the anterior teeth had that very significant red puffy halo that, the tissues just look really angry. And then posteriorly, things actually looked pretty pink. And, obviously I didn't have, any instruments to get in and feel tone and probing depths or any of that, but just the visual examination, when we see that red halo, that classic halo, primarily in the anterior, we need to immediately think this is a mouth breather. We're also very commonly going to see that thicker plaque along, just because, again, it's so dry and it's accumulating very quickly. So it's also common to see crowding and malocclusion, or obviously anterior open bite, but not always. And you may see, again, red, inflamed, and enlarged tonsils. And if asked, your patient will confirm a chronic sore throat. There may be a longer stretched out uvula, which we know can be caused by snoring. There might be a tongue tie, a high, narrow, vaulted palate, scalloped borders of the tongue, occlusal wear, recession, and abfractions from nighttime or even daytime bruxism, and a Mallampati score of 3 or 4. Now we're going to look at our x-rays. And we may be seeing generalized incipient or full-on decay interproximally, despite good home care practices. We have those patients that are telling you, "Hey, I'm brushing twice a day. I floss every night." We get in there, we take those bite wings and we look and we see interproximally like, oh my gosh, there's a lot happening here. Even if it's early and incipient, we're seeing it almost on every tooth. We need to suspect mouth breathing in those cases. Let's just take a breath because, that was a lot to look for. There's a lot of signs, which actually I think is helpful to us and makes it a little easier to be the detective. There's a lot of things that we can see and we need to pick up on to be able to identify what's going on and talk to our patients about it. So I find that helpful that there's a lot to look for because we can start putting those clues together to really help our patients see and understand for themselves what's going on. So once we see several of these signs, it's time to start asking questions. And the number one question you can ask, and I have been asking this now for quite a while, and it blows me away the number of people that say no to this question. So if you hear nothing else from this podcast, start with this. Start asking your patients if they have any difficulty breathing through your nose. Can you breathe through your nose? It is amazing to me how many patients say no to that question, and we just assume. And then you'll have patients that say, "I don't really know. I haven't really thought about that before." But you see those signs, it's time to challenge them to start paying attention to see what they notice. And I want to share a personal story of this. Whenever we hear new information, new studies come out, we can easily get feeling like, I don't know how to talk about this. What if my patient asks me a lot of questions? I just need to learn more. And yes, we do. But at the same time, don't let that stop us from moving forward. So what I want to say is, as I really started digging in and learning about this, I have a patient that I have been seeing since he was, I want to say, 7 or 8 years old. And he came in, it was his freshman year in college. So he was 18 or 19. And I was doing my oral cancer screening, and I noticed that his tonsils looked extremely large and red and angry. And I said, "Oh my gosh, does your throat hurt?" And he said, "Yes, all the time." And I said, "Okay." I said, "Do you snore?" And this being his freshman year of college and having a roommate was like, "Yes, it's really, really bad. My roommate is angry at me. Like, he says like he can't sleep. It's really obnoxious." I'm like, okay. I said, how are you feeling during the day? Are you feeling really well rested when you get up in the morning? Are you tired? He's like, "No, I am tired all the time. I have a really hard time waking up in the morning. I'll sleep through my alarm. It's been a challenge." And then I asked that magic question. Do you have any problems breathing through your nose? And he looked at me and he said, I've never been able to do that. And I honestly, as a practitioner, felt guilty that I'd never asked him that question before. And obviously, this has been going on for his whole life. And you'll know that as I tell the story. But I was like, oh my gosh. And he said, yeah, I've just never been able to. And again, I know him very well. I said, can I look up your nose? And I kind of looked up and you could see one side almost looked completely like it wasn't even open. It was really deflated and flat. So his mom had brought him to the appointment. She had another child there as well. Both of them were seeing me that day. So I said to her, I would love for you to take him to see an ENT and do a consultation. And we work with somebody here that we love. He'll do a sleep study if he's concerned. Like, I want you to go see him. So they did. And she called me back right after the consultation. She actually sent and shared the CT they had taken so I could look at it. And she said, they want to do a complete reconstruction. And she said, he asked me if I had any complications with childbirth. And I said, I did. In fact, I started to deliver and they realized he was bigger than we thought. His head was too big. So they actually pushed him back up and delivered him via C-section. And all we could think is, or what he suggested is, there was potentially some damage that happened in that process because his septum wasn't broken or deviated. It was in a complete S curve, like not functional in any way. And his turbinates on one side had not grown properly. So this kid was, just like I said, not able to breathe through his nose. And he was this chronic lifetime mouth breather. And so they ended up moving forward and getting that reconstruction. And he has had a 180 turnaround. He said, Charissa, I wake up at 8 a.m. with no problem. I don't feel tired anymore. I'm not snoring anymore. And I am super excited about this because I know we've set him up for success. His throat looks so much better. He actually was doing a good job on the home care front. He wasn't one of those that had that classic red halo going on. I think that he beat the odds on that side. So you're not always going to see that. But I think he's such a great example for looking at all the different things that are happening and asking these basic questions. So some other things that we can ask and should ask is, do you feel like you breathe more through your nose versus your mouth? And get some feedback on that. Because you'll have patients tell you like, hey, most of the time I think I am a nasal breather, but I have a lot of allergies or I have a lot of, sinus congestion and things like that prevent me. Asking if patients snore, or does your partner say you snore? A lot of people don't know that for themselves. Do you sleep well in general? Do you wake frequently? Or do you ever wake feeling like you're gasping for air or trying to catch your breath? Do you wake feeling refreshed and ready to go? Or are you feeling tired and sluggish throughout the day? Asking these questions is huge. Number one, for you as a provider to kind of know those answers and put the picture together. But it's even bigger for patients to help them gain an awareness and take ownership. They are hearing themselves say the answers, and that helps them put it all together. It's kind of like if you go to a really good psychiatrist or psychologist and they ask you a lot of questions about what's going on in life. And as you answer the questions, you're kind of coming to your own resolution and situation. It's the same thing in our chairs. So once I hear their answers, I let them know why I'm asking, citing, what I've seen and how these clues contribute to my suspicion of airway issues and mouth breathing. So just like him, when I was asking him, hey, does your throat hurt all the time? Are you snoring? Do you have any problems breathing through your mouth? Was able to say, hey, what I'm seeing in your throat, what I see when I look up your nose, isn't normal. So we need to get this checked out. And the fact that you're telling me you can't breathe through your nose, we need to set you up for better success here. So I know what you might be thinking at this point. Charissa, we're hygienists. We already have way too much to do in our appointment time. And I hear you and I feel that. But I want to remind you that we are here to save lives. And like I said earlier, we have a front row seat to all of this that no other medical care provider has. And I know we fall into thinking that flossing is the most important thing, but I'm going to argue that it's breathing, getting oxygen is actually the most important thing. So let's help our patients breathe properly. Let's ensure that that is happening for them, especially our kiddos. If we can set them up on the right track when they're young and get this addressed and looked at early on, we can really create a trajectory for their lives of health and wellness. And so When I see these signs and symptoms myself, and I ask if my patients can breathe through their nose, and the answer is no, then I recommend seeing an ENT and or doing a sleep study. And I have found an ENT in my area that does sleep studies and understands the magnitude of airway complications. So I know that I'm sending them to someone who will treat it seriously. And I say that because unfortunately in the past, I have had a few kiddos that have had tonsils that are just the size of golf balls. Like you look back there and know there's no airway. These things are practically touching. This kid, you can hear it when they breathe. They're constantly having sinus issues and allergy issues. And I have sent them, hey, they need to see their pediatrician. They need to see their ENT. And I think of one patient in particular that he's actually been to see 2 different ENTs, and they've just dismissed those huge tonsils saying, well, once they reach puberty, they'll likely grow out of it. So it's really important that you find someone in your area that really understands airway and why you would be sending that patient to them, and sharing the information, what you're seeing and what you're seeing on your side to put together so that they can put that together with what they're seeing and really treat the patient well. And sometimes that's going to take a little extra legwork of finding a good ENT in your area and almost interviewing them and sharing what you know and what you're doing. But I'm telling you, it is well worth it. I will say I do get a good deal of pushback from patients on doing sleep studies, and really for a few reasons. I think it takes too much time thinking about, I got to schedule that and I got to sleep in a place that's not mine. I know that they can be really expensive. And then if they're positive for apnea, I've literally had patients tell me this, like, I don't want to do the test because if I have it, I'm not going to wear a CPAP. So I understand all of that. And I recommend my patients start easy with doing a home study with the WatchPat. There are several websites out there that provide them for less than $200. It is easy. It syncs up with their phone. They mail it directly to the patient. It syncs up with their phone, so the data goes to their phone. They don't have to mail anything back in. It's disposable. They don't have to send anything back. And it gives them some really good initial data, at least as a starting point. And then what I say to patients is, try that, start there. And if it comes back and, it's telling you, hey, you've got some apnea symptoms going on, then take those findings to your physician and go from there. Let them determine next steps and what needs to happen. And also, I let my patients know there are a lot of other options outside of CPAP, especially as technology is coming along. I know there's the BiPAP, which is a little smaller. They now have the Inspire, which are the little implants that they can put in. I have a patient that did that and has had great success. Obviously, being in dentistry, there are sleep appliances that we can help them with. So let patients know, hey, taking a test doesn't condemn you to having a CPAP, but if it could add years to your life, because we know that apnea does cut back on longevity and quality of life, if we could make life better and longer, why wouldn't we want to do that? So thinking about doing an at-home sleep study is a great idea. And like I said, I think, I know sleepapnea.org has a WatchPat study. I think it's a fee of $180. So a lot of patients are like, oh, okay, that I could do. So just a good resource there. So if a patient tells me that they can breathe out of their nose, they just tend not to, then I suggest trying either the nasal strips at night to help kind of open things up, and or mouth tape, with a caveat. So I have a patient, I love this example. She came to me and she said, I'm really struggling with dry mouth at night. And it's so bad that I'm waking up to drink water like 4 or 5 times because my mouth is so dry, I'm uncomfortable. And I said, do you have any problems breathing through your nose? And she said, no. I said, great. This is going to sound crazy, but I would love for you to try some mouth tape at night. You can find it on Amazon. It is very inexpensive. There's like 15 different companies that make it. If you want it to be fun, there's one called Hostage Tape. Do you, but give it a try. And here's the caveat. If you put it on and like within the first few minutes, you feel like you're dying and you're freaking out and you're getting claustrophobic, take it off. It's not for you. There may actually be some other issues with breathing through your nose that we need to dig into. But if you can wear it, and it's going to be weird the first few nights, just kind of stick it out as long as you can breathe, then try it and see what you think. And I love her story. She came back and said, So obviously this solved my dry mouth problem. Like that makes sense, right? Because I'm not taking in the air, so things are staying moist. So that's been awesome. What I did not anticipate is she wears one of the watches that has all the sleep tracking metrics. And she said, I did not anticipate how much better my quality of sleep would be. And it's so much better. I'm in my REM cycles longer. I'm, sleeping better. I'm sleeping deeper. This has been great. I feel better. So she is now a firm believer and user of mouth tape. And honestly, I've had several patients with great stories about how much it has improved their quality of sleep, and just helping them feel better throughout the day. So don't be afraid to recommend that. Like I said, just give them the caveat of if you're feeling like you can't breathe, take it off. This is not a good fit for you. But I think a box ranges anywhere from $5 to $7. So it's a really inexpensive thing to try and see if it could potentially be a good fit. If there is a patient that has a tongue tie, a vaulted palate and malocclusion going on, then what we would want to consider would potentially be ortho, a tongue tie release, and maybe even some myofunctional therapy. Because here's the thing about tongue tie release. Yes, they're easy to do, right? Most of us have a laser in our office. My doctor's on like, hey, I can do that. Yes, you can. However, those patients don't know what to do with their tongue once it's released. And that's really important. Gaining some good tone for the tongue, because if it's been held down low and they've got low tongue tone, then that tongue just kind of falls down even more in that space. So learning how to exercise it, how to get better tongue tone, where to position it, how to swallow properly, where to put it for tongue rest, all of that really matters when we're trying to build good airway as well as good occlusion. So that's something to consider. Obviously, we want to work with orthodontists who are not just about aligning teeth, but thinking about, let them know, hey, I'm sending them your way because I'm concerned about airway. I'm concerned about, especially with our kiddos, if we see that tongue tie and we're seeing, any kind of a crossbite situation, we see a smaller, more narrow palate, and they may be a good candidate for expansion and kind of opening up and building that airway. So what we have to think about is the palate is actually the floor of the nasal cavity and the sinus. So if that's really vaulted, they don't have as much space up in that nasal passageway to breathe. So if we can broaden that palate out, widen it out, and bring that floor down, now there's more space and more airway for things to grow and develop and breathe properly. If you have a patient who is complaining of TMJ, they've got, the clicking, popping, pain, locking, or are aware of nighttime bruxism, then I definitely recommend a sleep study prior to doing a night guard. I know a lot of times our go-to is, a patient's having TMD disorder, dysfunction. They're in pain. We want to get them out of pain. So we start talking about Botox and night guards and things like that. We see a lot of wear facets. We start talking about night guards. We have to consider, is airway part of this story? Because we don't, for those patients who aren't getting enough airway, they're already mouth breathers. They've got a lot going on. They don't have a lot of space. Maybe these are patients who had premolars taken out for ortho and now they're in more of an ortho collapse. Well, now putting something else in there that's bulky is going to affect it even more. We're going to have an even harder time breathing with a night guard in there. So if we're thinking night guard, I strongly recommend doing a sleep study beforehand just to make sure that apnea is not part of that story. Because we want to make sure that we're not putting something into an already compromised environment that could complicate things even worse. All right, so I know that this has been a lot of information today, and I hope that it's been helpful. If you find yourself wanting more, like I said, please check out the books Breath and The Shift that I mentioned earlier, and also the IDM Scholar Society. This is where I've learned a lot of what I'm talking about today. And I'm telling you, once you see it, you can't unsee it. My kids probably think I'm crazy because we go to sporting events and church and things like that, where I look around and I'll kind of comment, oh, they're a mouth breather. They're a mouth breather. And my kids are like, stop it. I'm like, it's everywhere. So we've got a big mission here ahead of us. And I do think that there's a call on us to at least start talking about it with our patients, at least bring some awareness, at least bring some options. My number one challenge or takeaway is to start asking your patients if they are able to breathe through their nose. Again, I just think you'll be shocked by how many say no, not realizing that that's not normal or healthy for them. At least I have been. I would obviously love to hear how you guys are helping to educate our patients about airway issues and mouth breathing. So please come join in on Mighty Network if you haven't already, and let's have a conversation. Mighty Network is a free app. You can just download the Mighty Networks app and then search Bulletproof Hygiene and come on, let's have a conversation. I'm still in the process of learning so much about this, you guys. I need to learn more. So come talk to me. Tell me what you know. Ask the questions you have. Let's do this together. I encourage all of us to practice as our best selves, saving lives and promoting health every day. Have a great day, everyone, and I will see you guys next time. Bye-bye.